So what we're going to do here is if you could just take a breath in, just not too big, but then go all the way out. So just blow all that air all the way out and try and deflate your chest as far as you can take it. So you're really getting all the air out of the chest there. And so we get that down to about 99, and then take a deep breath in, as big as you can go. And we're getting up to close to 104, so 99 to 104. So it's about 5 centimeters excursion. So a lot of people will know that rib expansion test that's often used to rule out the likelihood of ankylosing spondylitis. And we're looking for 3 centimeters or more. So you have 5 centimeters, that's great. Normally, you know, the range is up to about 7 centimeters. But if this is tight, not only is there a risk of ankylosing spondylitis, but it shows you that this lower rib cage isn't moving so well, normally tied in with restriction in the thoracic spine as well. And if this lower rib cage isn't moving, if there's restriction here, then what happens is when the diaphragm contracts and pushes down against the viscera normally have nowhere to go, and so they splay the lower rib cage out as you breathe in. And if there's restriction in these ribs, then the only way the viscera can go is downwards into the pelvic floor. So this is very commonly associated with prolapse, with incontinence, those kinds of issues, hemorrhoids, any kind of pressure issue in the pelvic basin is often driven by restriction in the lower rib cage.
Okay. Now you used two terms there. You used associated and then you used driven. Association doesn't necessarily imply cause, does it? But you're saying it is causative. So that
in terms of the, I can't remember what I said exactly.
You said that the prolapse, and you said hemorrhoids and other things like that.
Yeah.
You said there is association between this and those conditions, and then you said it's driven by this condition. So this is causative.
I should probably say that I think driven suggests it's one driver, doesn't it? But it's a contributing driver in some cases. So
again, it's a really worthwhile thing to do for all sorts of reasons in patients.
Well, it's just this thing. You know, once you start to understand these mechanisms, you realise that you've probably been mobilising people's rib cages and lower thoracics for years without realising what a benefit that gave them to their pelvic floor. But if someone comes with a pelvic floor issue, you might not straight away think to mobilise the lower thoracics or check the lower thoracics, but that's absolutely key to minimise pressure issues down there.